Committee is going to come to order. Chair recognizes himself for an opening statement. Today we look to build upon our strong record of bipartisan success in public health as we consider 4 bills that address issues affecting trauma patients, newborns, and veterinarians. We have a proud record this Congress of working together, and the results prove it with a number of public health bills that have been signed into law by the President. And I'm especially pleased that as we kick off today's markup, Committee member Greg Harper has an excused absence as he is in the Oval Office for the signing of the Gabrielle Miller Kids First Research Act with the President. First, we're going to consider 2 bills from the committee members related to trauma care. H.R. 3548, the Improving Trauma Care Act, introduced by Bill Johnson, is designed to correct the inconsistencies in the definitions of trauma that have resulted in gaps in care and coverage. This bill will help important trauma centers like in my district, the Bronson Methodist Hospital's Burn Center in Kalamazoo, to better care for their patients. In addition, we're going to consider H.R. 4080, the Trauma Systems and Regionalization of Emergency Care Reauthorization, introduced by Dr. Burgess and Representative Green. The bill would reauthorize 2 programs related to the planning and development of regional emergency care. Both of these bills will improve trauma care so that Americans can promptly receive specialized life-saving treatment after a traumatic injury. Next, we're going to consider H.R. 1281, the Newborn Screening Save Lives Reauthorization Act, introduced by Representative Roybal Allard. Prior to passage of this bill in 2008, the number and quality of newborn screening tests varied from state to state. Today, with guidelines created by the bill, screenings reach some 4 million babies in the U.S. every year. Reauthorization will continue this important program and encourage more timely efforts to identify diseases such as spinal muscular atrophy and ensure best practices. Early screening and diagnosis often means better disease management and better outcomes for these kids. Finally, we're going to consider H.R. 1528, the Veterinary Medicine Mobility Act of 2013, which is a bipartisan, pragmatic solution to the confusion that resulted from the DEA's interpretation of the Controlled Substances Act. Veterinary medicine is very unique because vets need to be able to travel to their patients to make these house calls. It simply isn't practical to bring large animals, whether they be cows, pigs, or horses, to the vet's primary place of business. This common sense bill will enable vets to bring the medicines that they need with them so that they can provide proper care for their animal patients. Our members and staff on both sides certainly have worked very hard to bring these bills to markup today. I want to thank everyone. I look forward to building on the record that we have. I would now recognize my friend from California, Mr. Waxman, for an opening statement.
Thank you very much, Mr. Chairman. I want to thank you and the staffs on both sides of the aisle for the work done on these bills. These are bipartisan public health bills. They address a range of issues. They are all worked out, and I would urge everybody to support them. And I hope that, if you wouldn't mind, I'd like to yield to Mr. Pallone as the ranking member of the Health Subcommittee to talk further.
I want to thank Mr. Waxman and obviously Chairman Upton, and of course thanks to Chairman Pitts for his leadership. I'm always pleased when we can find common ground on important public health bills, and it's so important that this committee continue its focus on public health issues, since our actions in the public health arena have such a far-reaching effect on the nation's health. The 4 bipartisan bills today would strengthen existing programs or address new public health challenges. All of these passed unanimously in the Subcommittee of Health in February and have my full support. The first 2 bills are related to trauma care. H.R. 3548, the Improving Trauma Care Act of 2013, updates the definition of trauma in statute to include injuries from burns and chemicals or other exposure. In today's world, this is a common-sense change to current law. The next bill, H.R. 4080, the Trauma Systems and Regionalization of Emergency Care Reauthorization Act 4080, are aimed at planning and implementing trauma care systems in the states and establishing pilot projects for innovative models of regionalized trauma care. Traumatic injury is a leading cause of death for children and adults under the age of 45, so it's critical that states are equipped to deliver medical services. Now, again, thank Mr. Green and Mr. Burgess, who are leaders on trauma care, and for their work on these bills. Third bill would reauthorize the newborn screening program. H.R. 1281 extends newborn screening services and related activities for conditions like sickle cell anemia that are not otherwise apparent at birth, and if left untreated can cause severe disability or even death. The Senate has passed a nearly identical version of the amended bill we'll consider today, and I hope we can move this forward in the near future. And the last bill is H.R. 1528, the Veterinary Medicine Mobility Act of 2013. This bill clarifies that the Controlled Substances Act allows veterinarians to transport, administer, and dispense medicines while practicing in the field. Over 130 organizations have endorsed the legislation, including the 50 state veterinary medical associations. This, too, passed the Senate by unanimous consent earlier this year, and so I hope we can also move this expeditiously through the House and get it signed into law. And again, Mr. Chairman, these are good proposals I urge members to support. Proud to see another 4 bipartisan measures that can move through this great committee. Thank you.
Thank you. Chair would recognize the chairman of the Health Subcommittee, Mr. Pitts, for an opening statement.
Thank you, Mr. Chairman. I'm very pleased that the 4 bipartisan bills that the Health Subcommittee marked up on February 27th are being brought before the full committee for consideration. The first 2 bills, introduced by Representative Johnson and Dr. Burgess, deal with trauma care. The third bill reauthorizes newborn screening programs. I'd like to briefly focus on H.R. 1528, the Veterinary Medicine Mobility Act of 2013, introduced by Representative Kurt Schrader and co-sponsored by Representative Blackburn and more than 175 other members. This is a common-sense bill that is supported by the veterinary community and will bring clarity to the sometimes conflicting guidance from the Drug Enforcement Administration relative to the Controlled Substances Act and the ability of a licensed veterinarian to transport and dispense controlled substances in the usual course of veterinary practice outside of the registered location. Simply put, the bill allows veterinarians to legally carry and dispense controlled substances in the field. This bill has a direct impact on my district, home of the University of Pennsylvania School of Veterinary Medicine, New Bolton Center. Vets are often required to provide ambulatory services in the field, especially in rural areas, and for the care of large animals such as cows or horses. Sometimes it is not feasible for owners to bring the animals to a hospital or clinic like New Bolton Center, and so vets provide essential house call visits. Clarification of the law is necessary to allow vets to transport, administer, and dispense controlled substances outside of their registered location, whether to provide pain management, anesthesia, or euthanasia. Passage of this important legislation will allow veterinarians to complete ability to provide care to their animal patients beyond their clinics. And this will protect the health and welfare of the nation's animals, ensure public safety, and safeguard the nation's food supply. A companion bill passed the Senate by unanimous consent on January 8, 2014. Finally, the bill is supported by the American Veterinary Medical Association, the ASPCA, the American Animal Hospital Association, the American Association of Equine Practitioners, and a veterinary coalition coordinated by the AVMA of over 110 organizations. So I urge all of my colleagues to support not only H.R. 1528, but the other 3 bills as well. And I'd like to ask unanimous consent at this time to enter in today's markup record 2 letters of support for H.R. 1528. First letter is from the American Society for the Prevention of Cruelty to Animals. The second letter is from the American Veterinary Medical Association. Both of these organizations, among many others, support passage of H.R. 1528 and appreciate the support of this committee has given to the legislation and urges its immediate adoption. Thank you, Mr. Chairman. I yield back.
Thank you. The chair would remind members that pursuant to the committee rules, all members' opening statements will be made part of the record. Are there further opening statements? Gentleman from Texas is recognized for 1 minute.
Mr. Chairman, I appreciate the committee's leadership on having this markup on these bills. I'm also particularly pleased with the Trauma Systems and Regionalization of Emergency Care Authorization Act that's being considered. The bill authorizes trauma care systems planning grants and the regionalization of emergency care system grants. They're designed to ensure the availability and effectiveness of use of trauma care to save lives and save health costs, care costs, and improve patient outcomes. These programs can prevent trauma care center closures, drive the development of more efficient regionalized systems of emergency care. Currently, 1 in 7 Americans, 45 million people, lack access to a trauma center able to treat severe traumatic injuries within the first hour, which can be the difference between life and death. All these bills address serious health public needs and remind us that what we can accomplish when we work together and improve the health and safety of Americans. And I yield back my time.
Gentleman yields back. Chair would recognize the gentleman from Texas, Dr. Burgess, for a minute.
I thank the Chairman for the recognition. I am a co-sponsor of all of the bills under consideration, but I particularly wanted to talk about H.R. 4080, introduced with Mr. Green, which is the Trauma Systems Regionalization of Emergency Care and Reauthorization Act. A study released this week found that patients living near a recently closed trauma facility had an over 20% more likely chance to die from their injuries incurred in trauma. 2 years after closure, the likelihood of death increased to 29%, emphasizing the importance of these grants. I thank the Chairman for his commitment to synchronize this activity and work with the other programs expiring this year. And I want to thank the committee staff on both sides of the aisle, Mr. Green for his partnership on all these issues, Kristen O'Neill in his office, Adriana Simonelli with mine, and of course, J.P. Poliskevitz, who's helped shepherd this through to completion. I strongly urge support and hope to see these bills on the floor soon. I yield back.
Gentleman yields back. Chair would recognize the gentleman from Ohio, Mr. Johnson, for 1 minute.
Well, thank you, Mr. Chairman, and I'm very proud to be sponsoring the Improving Trauma Care Act of 2013, and I want to thank the committee for their work to advance the bill through the legislative process. You know, it's intolerable that 45 million Americans do not have access to a level 1 or 2 trauma center for care within that first golden hour after injury. Compounding this shortfall is the fact that the nation's traumatic emergency medical care system is plagued by inconsistent definitions of what constitutes trauma, definitions that currently exclude burn injuries. Now, I don't know about you, but if I suffer a traumatic burn injury, I want somebody at the hospital to think it's a trauma other than me. And I'm proud to sponsor H.R. 3548, which updates both definitions of trauma to clearly include burns. There are important gains to be made by the further integration of care and finding synergies between burn and trauma centers. In addition, I want to thank Dr. Burgess for his work to reauthorize trauma programs, and I'm proud to support his bill, H.R. 4080, and am grateful for his efforts to improve trauma care more broadly. I hope that all my colleagues on the committee will support this common sense legislation that prevents gaps in coverage and improves the provision of trauma care. Thanks, Mr. Chairman.
Thank you. Are there other members wishing to offer an opening statement? Seeing none, Chair would ask that the committee, that the clerk report the 4 bills to be considered and report the title of the bills.
H.R. 3548, to amend Title 12 of the Public Health Service Act to expand the definition of trauma to include thermal, electrical, chemical, radioactive, and other extrinsic agents. H.R. 4080, to amend Title 12 of the Public Health Service Act to reauthorize certain trauma care programs and for other purposes. H.R. 1281, to amend the Public Health Service Act to reauthorize programs under Part A of Title 11 of such act. H.R. 1528, to amend the Controlled Substances Act to allow a veterinarian to transport and dispense controlled substances in the usual course of veterinary practice outside of the registered location.
The Chair would announce that the bills are open for amendment, and I would announce that the Chair has an amendment to H.R. 1281, and the clerk will report the title of the
amendment to the committee print of H.R. 1281 offered by Mr. Upton.
Yeah, but we can do the amendment first. The staff will distribute the amendment. It's at the desk, right? And right. And it's been an agreed to amendment, a manager's amendment. I don't think anyone has any issues with it at all, but we'll wait till it's distributed.
Mr. Chairman, we support the amendment, and I'd ask unanimous consent that the amendment be agreed to.
Without objection, the amendment, the vote is on the amendment, and all those in favor will say aye.
Aye.
Those opposed say no. Opinion of the Chair, the ayes have it. The amendment is agreed to. Are there further amendments to any of the 4 bills before us? Seeing none, the Chair would ask that would ask unanimous consent that the committee adopt and favorably report the bills as amended. H.R. 3548 as amended by the Subcommittee on Health, H.R. 4080 as amended by the Subcommittee on Health, H.R. 1281 with the amendment adopted by myself, and H.R. 1528 as amended by the Subcommittee on Health. Without objection, so ordered. All those in favor say aye. Aye. Those opposed say nay. You need a chair. The ayes have it. And without objection, the bills are passed. Without objection, the staff is authorized to make technical and conforming changes to the bills reported by the committee today. So ordered. And without objection, the committee stands adjourned.